Eczema is a common condition that affects children and adults. It can be mild, causing the skin to be red and itchy, but it can also be much more serious.
Eczema can be a very serious condition for people. It's inflammation of the skin, and it's typically going to present as red, scaly, itchy patches on your skin. And sometimes it's so bad for people that it'll actually blister out, and you'll get water blisters on your skin and it'll ooze.
Eczema can flare up in young children, and while it looks menacing, it does clear up with no scarring. Sometimes kids do grow out of it, but it can flare back up at any time. As for the cause, doctors say it can be genetic, but they're still not sure. What they do know is it's an autoimmune disease, a disruption in the inflammatory system, and that extreme temperatures can make the condition worse.
It's extremes in temperature and humidity that can really aggravate it. So if you're in a cold, wet climate, or if you're in a hot, dry climate, or the climate changes, we'll see flares.
What's also worrisome for doctors and patients is that eczema can lead to serious infections if left untreated.
Here's a classic example again of how the skin breaks down with eczema. It oozes a little bit, leading to this honey crust, and this is what allows that bacterial, viral, or fungal infections to penetrate into the skin.
Basically, Dr. Joshin explains the barrier to the outside world breaks down, and that can increase the risk of infection.
So people can develop staph infections, herpes infections, all kinds of infections. The typical way we'll treat it is to start applying a mild potency topical steroid to an aggressive potent topical steroid. That will calm down the inflammatory lesions on the skin, and typically it'll get better right away.
However, there's a new medication on the horizon for the treatment of eczema, Boron, currently in clinical studies that Dr. Joshin believes shows great promise.
The exciting thing about the Boron for the treatment of eczema is that it is non-steroidal, which means it doesn't thin your skin. Whereas, we have the calcineurin inhibitors, Protopic and Elidel, which are great because they're non-steroidal as well, but they have this black box warning saying that there's this small chance that you could develop lymphoma or skin cancer from the drug.
The doctor is currently doing an eczema study on the new drug and is actively looking for volunteers, adults and kids with a history of eczema. If you are accepted for the 4-week trial, all your medications will be free and you'll be paid for your time. Just call his office at 760-416-6971. Janet Zapala, KMIR News.